Good evening and welcome to another episode of Fresh Natural Live. We are here today with another great show for you. I hope your Monday was enjoyable and productive. And of course, I hope you had a productive and restful weekend. As It's okay to have a productive weekend as long as you get some rest. We're going to be talking about a situation, a patient that we saw in our clinic who suffered sudden cardiac arrest. And after we reviewed his clinical data, there was some interesting time relationships between him getting one of the COVID vaccines, I believe it's the Pfizer vaccine, and his cardiac arrest. He also had some interesting biomarker findings. We present this case by way of educating our audience in terms of what patients with cardiac disease or history of cardiac disease or risk factors of cardiac disease, what precautions they should consider in the setting of getting vaccines. And I'm going to share some of the things that we're doing with our patients to monitor patients after the vaccine, also monitor patients around the time of them getting the booster shot. And some of what I think could be some best practices and some things you as a lay person or a professional person may consider. So sit back and relax. I think we have a great show for you tonight. Also, we're going to have Dr. Doug Harrington. He's the medical director of the lab that runs the inflammatory marker scoring test. And we talked about this test about 2 weeks ago. And there was breaking research in Circulation magazine that showed how the vaccine showed an increase in percentage of risk of cardiac event in the next 5 years based on this PULS test. So we're going to go over some of the PULS test data in this patient. And Dr. Harrington, who will be joining us from Montana, his signal may be a little bit iffy, but he's able to get in. He's going to discuss the PULS test and these findings. And I think you're going to get a lot out of this show. So stay tuned. Look forward to hearing your comments. Hello again, and welcome back to our show. As I said, we're going to talk about the issue of sudden cardiac arrest in a patient after receiving the vaccine, one of the Pfizer vaccines for COVID-19. We're going to talk about the potential ramifications of the vaccine in people with heart disease, what you should do to monitor your cardiac situation if you're getting the vaccine or if you're getting the booster shots. But before we get into that, I want to invite my guest and colleague and friend, Dr. Pam Atkins. Hello, Dr. Atkins. How are you doing?
Hi, good evening. I'm doing well.
Good. So, we talked about this briefly, and it ties into a show that we did about 2 weeks ago in the context of individuals with heart disease. And so there was another patient I presented in that discussion. There was a lady who had, was 6 months after the vaccine, started having cardiac arrhythmia and a low ejection fraction. She went on a detox program and, did have improvement in that. She also had elevated troponin levels. So there's some similarities in her situation as with this patient. And I want to discuss those similarities and talk about these clinical findings in the setting of the data that we reviewed, a publication in Circulation, which showed that the Pfizer vaccine, I think it was, increased. I think those patients had Pfizer and Moderna, but there was an increase in the risk of a cardiac event by 2.5 times. So we want to look at that, these clinical scenarios in the setting of that data. First, I want to say hello to some of our people joining in. Barbara Saunders, Carol Hoskin-Burks. Hello, Thomas. How are you doing? Joy 31608. Good evening, Thomas. Hello, Alexa Starr. And Joe's daughter of Zion. Peace and blessings. All right. Peace and blessings to you. And Larry Lampkin. Hello, JW. Hello to everybody. And thanks for joining us tonight. So without further ado, I'm going to share my slide with you. And so sudden cardiac arrest after COVID-19 vaccine, a clinical case review. Oftentimes there, people talk about various reports and there talks about, well, I know somebody who, had an arrest or died in their sleep or whatever the case may be. But we don't always have a lot of clinical data with that. So here I want to, discuss a reported clinical event, but also look at the data. Before I get to that, I see we're joined by Dr. Doug Harrington. Hello, Dr. Harrington. How are you doing tonight?
I'm doing great. Thank you.
Wow, that sounds good coming from Montana.
Yeah. I'm in the midst of a snowstorm in the middle of nowhere, Montana.
Oh, my goodness. So anyway, well, I already told the audience, if you drop out all of a sudden, we hopefully that won't happen. But anyway, as I was sharing with the audience, I'm just getting into the case presentation. And there's a sudden cardiac arrest after COVID-19 vaccine. So here's the story. This is a 60-year-old man. He had a medical history, known coronary disease. We'd been seeing him for a number of years. He had prior stents, he had a history of prediabetes, and he had a history of increased PULS scores. So, and I have that data on here. I've actually brought those tests up. I've kind of sanitized the name. And he suffered a cardiac arrest in October of 2021. Now, the PULS test we had gotten go back to 2018, maybe 2020. And so he had a PULS score in the 7 range and into the 9s. But in 2020 through 2021, he got on a nutritional detox regimen. Had been eating 100% plant-based, mostly raw. And he got his PULS score down to around 4.7. I'll give you those numbers in detail as we go through the case. And so that was in October of last year, was that PULS score. And so then he took the vaccine in March and suffered a cardiac arrest in October. So PULS score down to 4 in October 2020. Vaccine in March of 2021, cardiac arrest October 2021, and we see him in November of 2021 after recovery, gets a defibrillator, etc. So I'm going to go through some of the medical records. These are some of the records in the hospital chart. A 60-year-old man, he presented with cardiac arrest. He was on the golf course, so he was playing golf with some friends, and the story was told to me by his daughter, who I guess had gotten it from the friends. He doesn't remember much of any of that, but he was getting ready to tee off. And so I think everybody was sort of, not watching him tee off. And they noticed kind of a delay. He's not hitting the ball. Next thing you know, they turn around and he's lying flat on the course. And so they start bystander CPR, call the paramedics. They get there within 15 minutes. And so he's taken to the nearest hospital. He is documented to be in VTV fib, so he's get shocks out of cardiac arrest. And they mentioned that he had VT storm, so they apparently must have shocked him multiple times, had some unsuccessful shocks. And the concept of VT storm, I want us to keep that in mind, because we have VT and it's very hard to terminate. We call that VT storm, and that may be due to something that's irritating the system. Not 100%. EF was 30 to 35% at the time we went to the hospital, based on echo and heart cath findings. And prior ejection fraction was around 40 to 45% or more. So left heart echo, EF 30 to 35%. Not much in the way of a lot of valvular disease, essentially low EF and wall motion abnormalities. The coronary angiogram, again, these are busy slides, and I'm doing it for some of our people who are medical experts who may want to see more details. So I'm not trying to inundate you with information. So these screens, you can do a screenshot and look at the details. But there's diffuse coronary disease. There's some small branches that have diffuse disease, and some that are occluded. But again, the EF is 30 to 35%. And the angiographer didn't feel that there was a corporate vessel, that was a chronic, totally occluded right, but nothing that was obvious in terms of an acute vessel with, a plaque, unstable plaque that could be angioplasty that would explain this cardiac arrest. And so what I want to do is should briefly mention an abstract publication in Circulation that we talked about a couple of weeks ago. And it talks about the mRNA COVID vaccines that dramatically increase the endothelial inflammatory markers and acute coronary risk as measured by the PULS cardiac test. And I'm not going to go through the details of this like I did before, but essentially in the abstract, the investigators, they had about 566 subjects. And this is a preventive cardiology clinic, and they get pulse scores about every 3 months to 6 months. And so they have a nice database of pulse scores over time. And what they noticed is that a number of patients had significant increases in the pulse score about 2 to 3 months after getting the vaccine. And what they found is that there was about an average 11% 5-year acute coronary syndrome risk that increased to 25%. So roughly 2.5 times increase. So this is nearly a 1 in 10 chance of having a cardiac event in 5 years versus a 1 in 4 chance of having a cardiac event in 5 years. So that was a pretty significant increase in this population. And their follow-up extended about 2.5 months out. So clearly that's an extended period of time. And I don't think they cut it off, but that's at the time of this publication. So what I want to do is take a break here. I'm going to pull these slides out because I think that's the end of my slides. And I'm actually going to share another screen with you that's going to go through some of the actual data, the actual pulse data. And Dr. Harrington's here. He's the expert, so I'm not going to say anything about the pulse data. I'm going to let him say everything about the pulse data. And while I bring this up, Dr. Atkins, Dr. Harrington, any comments or questions based on what I've discussed so far?
So the patient had ejection fraction of 45% before and 35% after, correct?
That's exactly right. Yeah. So there was a significant decrease from when he went in with the event. And that's an important point to make because, there was about a 10% drop. There was no corporate vessel. There was a VT cardiac event. Now, you can postulate that due to the cardiac event itself, which, again, had maybe 15, 20, 30 minutes to resuscitate, he probably built up some level of inflammatory markers, increased cytokines, et cetera. All of that could have biochemically suppressed or caused some level of hibernation, maybe even some stunning of the myocardium. So you can certainly explain it based on that. But clearly there wasn't a culprit vessel that they saw. And even in the setting of coronary angiograms, I've done coronary angiograms in individuals who are clearly having heart attacks. And I do an angiogram and I see all the vessels look good. So you can have an occlusion that then spontaneously revascularize when the system thrombolizes the thrombus. And so the vessels don't look occluded because the clot's been dissolved and all you see is the chronic stuff. And you may not see the 10% plaque that was actually the culprit plaque. So all these things are possibilities. But what we do know is that there was significant decrease in the ejection fraction. And we also know that he had VT storm, which if someone has, VT storm implies there's some ongoing process that's feeding the ventricular tachycardia. Not 100%, but it implies as much. So anyway, what I have here, his pulse score in August of 2020 was 9.15. I'm going to scroll through here, and Doug, if there's anything you want me to stop, pause at, and you want to point out, just feel free. But I'm going to go from pulse score to pulse score. So this is what we have, the IL-16. These are different parameters.
Yeah.
A1C was 6. He was pre-diabetic. and those are the numbers there. His
Yeah,
pulse,
Baxter,
sorry?
what was interesting is that this is the later one, right?
This is the one
The first one,
before. This is in August of last year, August 20th of last year.
right,
Let me get my date straight. I
right.
want to make sure I'm in the right chronological order here.
Because
Uh,
this one says November of
yeah, this was
2021.
November. Okay, this is the latest one. So this is the first one. Okay, this is before, and then here's the second one in September of 2021. This is all
Right.
before the, okay, and then this is this is where it went down. Now he
Mm-hmm.
had already had the vaccine. Now he had been on a diet, and I'll show you the summary for about a year and a half.
This is before the vaccine, though, right? That
This is what
4.74%.
the 9.15 is before the vaccine. This one
Mm-hmm.
in September, this is after the vaccine.
I
Okay.
see.
And then this is
Uh-huh.
also after the vaccine. This is after the vaccine and after the cardiac arrest. And,
Uh-huh.
and that's why I wanted to share with
Uh-huh.
you the this is not as clear cut as the data that we saw there. In terms, you have an elevation after the vaccine, but you also have a number where this is lower after the vaccine also. We don't have a number between August. This is a 1 year, from here to here is 1 year's time. But we know he's been on a diet
Right.
and been improving his diet throughout that time.
Did
Yeah.
did you say he
So-
had? Did you? Oh, go ahead.
No, it's okay. Dr.
Okay.
Atkins, go ahead.
Okay. I was wondering, did you say he had a cardiac arrest a time between the first two pulse tests? Did you say he had a sudden cardiac
Yes.
arrest and he was resuscitated and came back?
Yep, the cardiac arrest occurred in October of 2021.
Okay.
So the September, October, November went up significantly. Well, I think what's interesting is you were treating him aggressively with diet,
Yes.
and you got his score down. You know, the patients in Dr. Gundry were already on some programs and then got the vaccine, and he follows them up. I also noted that this patient was a chronic total obstruction patient.
Yes.
And you know what's fascinating about that is the theory used to be that the reason they survive is because they have collateral circulation. But when we started looking at the myocardium, it turns out that what happens is the myocytes actually go to sleep. They hibernate, they don't die.
Yep.
And if you don't correct it, or if he doesn't develop some form of collateralization, then they fibrose and you get remodeling, which is not a good thing in these patients because then they go into failure. He clearly had some post-arrest failure, but a very peculiar distribution of disease, one chronic total obstruction and lots of little things. And I'm curious, what was his family history?
Family history, and I'm going to pull this up on the side. I won't share that screen, but what we have in terms of his family history, we didn't have any documented family history. I don't know if he knew his family history that well, but he didn't report much in the way of family history.
Yeah,
That's just,
yeah.
I'm just
Because I
pulling
mean,
that
to me,
out of the record.
yeah. What's interesting, and when we get a chance, I'll show you a couple of patients that actually had COVID and what happens to their pulse scores. But it's interesting because all the vaccines induce formation of a biologically active spike protein, and it still binds to the ACE2 receptor, of which the endothelium has one of the most dense populations of it. And it gets internalized just like as though it had a virus attached to it. And there's some evidence that it interferes with DNA repair. And it can result in a low-level inflammation and damage to the endothelium, making you more susceptible to problems down the road. He may be one of those people.
And see here,
Because you had him well controlled.
Yeah, and the question in my mind is, did we have them even lower than this? And could the vaccine have gotten them here and then progressed through there? So we got two pulse scores that go up successively after the vaccine, and he's still following the diet pretty closely. And I mean, he's eating like 100% raw for the better part of 18 months by his report and our, documentation. And so it's possible that this score could have been lower. We don't have that data, so I'm just speculating. So that's the other question mark. So anyway, and this is the pulse score. This is the final pulse score. He's back at 9.67. This is after the arrest. So I can show you just so that the audience can keep up. So we have here the dates. This is all baseline. He starts the nutritional regimen somewhere around here. And this goes down, but the nutritional regimen as well as the vaccine comes somewhere here too. So we don't know if he came at another point here and he went up here and he went up there. That's a question mark. But the vaccine is somewhere here. We know that this is lower and this goes up. So could this be a continuum of something that was lower before the vaccine and it could have gone up?
Well, he had such a dramatic. Yeah. I suspect that's the case, Baxter, because he had such a dramatic response to your diet. Anyway, that it wouldn't surprise me because most of the people we see go up a little bit with the vaccine temporarily.
Yeah. And the thing is that it's unpublished data. We need to get it published, but we showed a 26% reduction in the pulse score in just 4 weeks on our diet. And so that detox reaction, and I want to point that out because that's going to get into some of the things I'll comment on later in terms of, what we do. The other piece of data I want to share, he had a little bit elevated troponin level, which persisted. And so we try to get, this says normal less than 6. We try to at least get the ultrasensitive troponin below 10. But less than 6 is optimal. He stayed above 10. So this, reports some increased risk. Is a low level myocarditis. And we've been checking ultrasensitive troponins in a lot of our patients just to get some understanding for what may be happening to them. So so here we have a gentleman, I'm going to stop the sharing of the screen and kind of discuss this, unless there's any other data you want to see, Doug or Pam, regarding the pulse scores, or I can bring that up because I know we looked at the total score.